Diagnosis and treatment of Syngamus trachea infection or Syngamiasis. For the diagnosis, we first need to consider the clinical history along with different epidemiological factors in the occurrence of this disease. We need to check the different clinical signs that I have already mentioned, and post-mortem examination of the dead bird will also confirm the Syngamus trachea infection or Syngamiasis. For confirmatory diagnosis of the affected live birds, coproscopy can be done. The eggs of the Syngamus trachea is ellipsoidal and there is thick operculum at both ends. These eggs must be differentiated from the eggs of Capillaria species because both eggs look similar. Treatment of Syngamus trachea infection or Syngamiasis. Different anthelmintics such as thiabendazole, mebendazole, fenbendazole, etc. can be prescribed for the affected birds.